Now, I should just tell you I've got people who are joining in from the US, people from the UK, where it's now 11 o'clock at night, and that's where Dr Ranj is, and also my friends in Australia because it's 8 o'clock in the morning. So we are going to, Dr Ranj has just joined, so I'm waiting for, let's see, I should see him come up soon so we can join. But we're going to be talking about the coronavirus because there is so much misinformation about, and there's so much anxiety about. Here we go. Dr. Ranj should be joining me now, all the way from England. Somebody said he's actually a hunk. Good evening, hunk.
Hi, beautiful. How are you?
Fucking beautiful. Sounds like a brand new.
I'll take that.
Thank you so much for joining me. Now, as I said in that little bit of an intro there, I mean, I know you from television, where we both work, I guess, Good Morning Britain and for This Morning.
Yeah.
But people watching from the USA, and I know we've got some people watching from the USA, people watching in Australia as well, probably don't know who you are. So
No.
a quick resume.
Well, this is surreal that we've got people across continents around the world. I couldn't believe it when you put the post out. I thought, hang on, it's different time here and it's a different time there. But yeah, so my name's Ranj. I am my day job is that I'm an emergency paediatrician. I work in the NHS here in the UK. And I kind of have this weird dual career, I suppose, because I also work in television, and that's how I know you and your lovely self. I have a children's TV show that is also shown in Australia sometimes, and I work in daytime TV in the UK, and I also have an evening show, and it's all kind of health related, obviously.
Yes.
I've also written a couple of books. I've done little bits and pieces here and there, but
how
yeah,
do you like a book on losing weight without spending too much money? And so you
basically
what I like, and I mean, you know, you and reading your pieces on the virus and the bits you've done on Instagram is that you cover the whole gamut. And I did say to them if they've got any questions to see how many we could get through. Okay, so the virus, that's what everyone's worried about. But what I wanted to do is ask you joined up questions, because often it tends to be one thing or another.
Yeah.
Okay, so if you wouldn't mind going to the supermarket, okay? Out into the supermarket, get into my car, arrive. Now, I don't know if it's the same in UK, but here you stand in a line, in a queue, and, you know, so do I take gloves? Do I wear a mask? When I do social distancing, because they make you do it in the stores here, what happens when it comes to packing my goods? So I thought we'd go through a scenario, going to the supermarket. So we sit in the car, we get it.
Okay, so what we have to remember is that there are different rules according to where in the world you are, and it just, those rules, isn't that one person is or one country is right or wrong, they just interpret the evidence slightly differently. So here in the UK, the very basics that we should all be doing across the world is making sure that we wash our hands, making sure that we socially distance from other people, and if we're unwell, trying to minimize that contact with other people just in case we are spreading things around. However, we do realize that we have to go out and do our day-to-day essentials. Some people have to go to work, some people have to go and get groceries, some people have to get medical supplies or look after a loved one that needs them. In those situations, it's all about being as sensible as you possibly can. Now, when you look at...
Should I wear gloves? Should I wear mask and gloves?
Yeah, so what we would say, actually, the evidence for masks, the strongest evidence for them, they are helpful. However, for the vast majority of people, they're only useful if you have symptoms and to stop you spreading it to other people. But bear in mind, it has to be the right kind of mask. They become less effective the more you wear them, so you have to change them. And the same...
Let me stop you there. So number one, if you don't have the virus and you're perfectly well... people seem to be wearing masks over here in the States. The thinking being that if somebody comes up to them and coughs in their face... then they're going to fall in a heap. You're saying that only if you're showing symptoms, and you say the right kind of mask.
Yes.
What's the
Yes.
right and the wrong kind of mask?
So basically, I've seen lots of people wearing fabric across their face, scarves, or surgical masks. The thing is, the fibers within those masks, they cross like that. Right. And the virus can get in between the fibers because it's of a certain size. So special masks, special medical grade masks are built so that those fibers are very tightly knitted together and the virus cannot filter through. However, standard masks in fabric, it just comes in. You might as well be wearing nothing.
Oh, so all the fabric ones. What about, I mean, you see most of the people just wear these blue ones, over-the-counter ones. Are they the medical masks?
No, the actual masks that we know significantly reduce transmission are the medical grade FFP3 in the UK, they're called. They're basically quite thick, usually white masks, or in hospital you'll see them wearing all sorts of contraptions which are a lot more, I suppose, strict. But the standard ones that people are wearing out in the streets, they're probably not doing a great deal. The risk is it may make you complacent because you think you've got a mask on, you think you're protected. So you take more chances, you get closer to other people, you don't get so worried about touching your face. In fact, the mask may make you touch your face more. So this is the problem with gloves as well. People put gloves on and they forget that the virus doesn't get in through your skin. It sticks to your skin and then you touch something. And they put gloves on. They don't wash their gloves. They don't wash their hands when they've got gloves on. They touch everything, touch their phone, touch their shopping, touch their face, touch other people. Then they take their gloves off and wash their hands. Well, you may as well not be wearing your gloves and just be washing your hands. That's far more effective.
Well, I wore gloves once, and actually what you say, what you say, because there becomes this sort of hack mentality.
It's good if you change them if you change them between every contact, then gloves can be useful. That's why we use them in hospital.
But you'd be getting through dozens and
dozens. Hundreds. Yes, exactly.
Now, some shops over here have said, they've done away with carrier bags and what have you. Sometimes, and I think this is a ruse, who said, no, you can only have our bags now because you might be bringing something in on your own bag. Ruse or truth?
Okay. So the chances of spreading coronavirus around on goods or letters or packaging is very, 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 very low. In fact, if you're worried, absolutely, if you're worried, I've got some people that are quarantining their groceries and their shopping when they get home and then they take them out.
So you listen, I've heard, you've got to wipe down every package, you've got to wipe and wash your fruit, even more than you normally would.
To be honest, what I would say is when you get home and you bring your shopping or your groceries home, unpack it, put it away, then put the bags away or throw them away, whatever you want to do, then wash your hands. That's the most important thing because your hands are the predominant spreaders. And if you've got food that you can wash, it's a good idea to wash it, I think, for general hygiene anyway, but particularly in these times, it would be important.
Okay, so you're doing all of your social distancing. Let's say, like me, you're a charlatan. You go out without a face mask or gloves.
Well, if you're distancing adequately, you shouldn't need them.
Exactly. Well, one tries to distance. Yeah. So you're saying when you get home, you unpack everything. What about if you go to, because it's interesting, one of the essential shops here is the bottle shop. Now, do you wipe down all your bottles?
What's a bottle shop?
A bottle shop. Oh, well, the Aussies will know what that is. It's an off license.
Oh, right.
So you go buy some wine, vodka, gin, whatever you like. Do you wipe that down?
Well, it's up to you. I wouldn't personally. I would just put it away like you normally would do and wash my hands. The virus can only survive for a certain period of time on surfaces, and it's not going to be for the full length of time on every single surface. So like I say, the chances of picking it up from something like a bottle are very, very low. You're much more likely to pick it up from opening a door and touching the handle that lots of people have touched. Or, for example, going and using your phone because you don't ever clean your phone.
Yes, that's you see,
these things are much more important.
You see people using their phones like this as well. Yeah, and that's one thing I started to do on my iPad as well.
Yes, absolutely. If you swabbed people's keyboards, you'd be shocked at what you might find on them.
No, well, maybe not. And also, there's a good point to make because so many cars are touchscreen now.
Yes.
And I'm guessing if you've been out and you've touched what have you, and then you put in the directions or something, you forget your car could be a hotbed. But how long does the virus, people are asking how long the virus lasts on something like metal. There are all these things like, oh, it lasts longer on metal than it does on plastic, than it does on wood.
Yeah, it does. The exact figures elude me right now, but it tends to last longer on harder surfaces, so metal and things like that, than it does on porous surfaces like paper. And plastic, I think, is somewhere in between. It can last anywhere between hours to days in ideal situations. So that's what I would say. At home, clean your surfaces, clean your hard surfaces. That's important. Clean your door handles, clean your keyboards. That's really important at home. Other than that, just wash your hands. You're fine. You're going to be okay. If you go out and about, come in, wash your hands. If you're handling lots of different things, put them away and wash your hands. That's the important thing. And try not to touch your face.
And try not to touch your face. Now, I baked some, one of my neighbours is going through chemotherapy, and I made her some oatmeal, and I wore gloves.
Good.
I put them into clean containers, did all of that. Now, there's some people that say, well, you know, I took the containers, I left them outside her door, so and I told her it's there so she could come and get it.
Okay.
Now, is there danger if you're kind enough, if you're doing something like baking a cake or making something for a neighbour? There's some school of thought. Some people are saying, well, you could be passing on the virus to them when they pick up the container.
Yeah. So the chances of doing that are extremely low, I would say. The only time that it's a risk is if you were sick. So if you were poorly and you had symptoms of potential coronavirus, then I wouldn't be doing something like that, because you do risk passing on, particularly if you're handling things and then passing them to somebody else directly.
Right.
However, if you're absolutely fine and you're taking all the precautions that you normally would do, washing your hands when you're preparing food and things like that, you know, distancing from your vulnerable friends and family, which it sounds like exactly what you're doing, then actually the chances of passing anything on are minimal. And actually minuscule, and I wouldn't even worry about that.
There's honestly, there's so much panic about me about this. Now, one thing that certain outlets have decided to bang on about is testing.
Yeah.
Test everybody.
Test.
I've got to say, my daughter works in National Health Service, and she had to self-quarantine while her caseloads piled up. And I think she was justifiably angry because she had a cold. And it's like, you know, if she's tested, she knew she could go back to work and basically help people more.
Yes.
But this seems to spread into the general population that you should test everybody.
Yeah. See, testing has a place, absolutely, and you mentioned it right there. So there's two different types of tests. There's a test that tells whether you have the virus right now, and then that's for people who have symptoms or are going to hospital. In certain countries, it may actually be offered to the general population as well. And then you have an antibody test that tells you whether you've had it in the past. So technically whether you're immune. Now, the one that tells you whether you have it right now is useful for people to find out if they need to isolate.
Yeah.
So, for example, really important for workers, healthcare workers, frontline workers, to find out whether they need to isolate or whether their families need to isolate. So logistically, it can help people get back to work if they need to.
Yes.
And, you know, minimize disruption in their lives. The antibody test, the one that tells you whether you've had it, is going to be much more important in terms of helping us decide when we can lift restrictions. Because if enough people have had it, then we can say, right, there's immunity in the population. We can relax our restrictions and we can start getting back to normal. Is testing going to make a massive difference, though? I'm not sure.
Yeah.
So most of the countries that have done lots and lots of tests, and there are countries out there that have done testing right from the start, they've done quite well in controlling their pandemics. However, testing isn't the only thing that they've done. They've done lots of other things as well.
I was looking at Ireland, for instance. People are comparing Australia, New Zealand, Ireland, but they have less densely populated areas.
Yes.
I mean, they have a lot bigger rural areas and people aren't as squished together. Now, somebody said, can they catch it if they order food in? Well,
no, not at all. No. Unless the only right, I'll caveat this. If you order some food in and your delivery driver or driveress happens to have coronavirus and they cough and sneeze directly onto your takeaway dish, they're not going to, and then you take it right off them and you grab it and then you rub your face, yes, then you might get it. However, that is just not realistic.
But does heat get rid of it?
If you heat your foodstuffs to a high temperature, then it should inactivate the virus. We know that.
That's if
however,
all over it.
that's if they've coughed in an open packet of your food. But like I say, people were worried about getting Amazon deliveries and ordering things on the internet and things like that, and getting worried about ordering their weaves from China. And I was like, you're not going to get it. It doesn't work like that. Or frozen food.
So frozen food, no, it's fine.
It's not going to, the chances of something like that are very, very minimal. And if you're really, really worried, you can wipe your packaging down, but it's a hassle and it's just not worth it.
No, and I tried doing that with a book I ordered, and I lost the title page. I don't know what the damn thing's called. Anyway,
in fact, it survives if the virus survives for a shorter period of time on paper. So actually, that's the least risky thing. So if you've got paper grocery bags, which they tend to do in America,
yes, they do.
And letters and packages, it doesn't tend to survive on those porous surfaces quite as long.
Right. Somebody said they haven't ordered a takeaway for ages now. But now here's something else. While we're talking about grocery shopping and food and immunity and what have you, and I'm aware that people are living in unusual circumstances.
Yes. Yeah.
How important, and let's bear in mind that not everybody's got the finances to do this, but how important is it to keep an eye on your basic nutrition?
Yeah, that's really, really important, actually. I would say in these initial phases of lockdown, as places go into lockdown and people are having to adjust the way that they're living and cope with all the stress and anxiety that brings, things like nutrition will take second place. And that's fine. That's absolutely okay. We have enough stresses and strains in our lives than to be getting frenetic and panicked about what we're eating and whether we're getting everything we need to. However, in the longer term, as we're going into this more and more, I think it is important to think about nutrition and just to make sure you are getting everything that you need to support your body, to support your immune system to work at its best. And that's not just about food. That's about making sure you're getting enough sleep, because that's really important for your immune system. Yes. Trying to get a bit of activity as much as you can safely, that's really important. And trying to manage your stress. Stress, we know, raises your stress hormones. That has a negative impact on your immune system if it's significant. And that's why we say it's not just about one thing, it's about the totality. And I'd much rather someone chilled out and had some cake and relaxed and took care of themselves and had a bit of self-care and me time, than if they were all stressed out, eating celery, and their anxiety was going through the roof. It's all about balance, and it's all about being sensible.
And I think what you're talking about is the whole mental health aspect. My daughter works in mental health, and one thing that I think the mental health services are being prepared for is the aftermath is going to last a lot longer than the physical impact of this thing.
Yes, absolutely.
And we say to people, stay at home, stay at home, stay at home. And there are things like domestic violence and what have you, in extraordinary circumstances where it's not even safe for people to stay at home. So I think it's worth remembering that. Talking about exercise, here's the one that I've heard. I'm just throwing at you all the things.
Come on then, keep them coming.
Running, when you're running, right? Somebody's saying you can pick up the virus in a runner's slipstream as they go past.
Good point, actually, because one of my friends brought this up the other day, because I like to go jogging. Most people have started, all of a sudden everyone's started jogging because it's a great form of exercise. The point about transmitting it when you're around people is if you are in close vicinity to others for a long period of time, that someone might cough or sneeze and generate some droplets, and then you might pick them up. However, the virus isn't transmitted by breathing. So you don't form those droplets by breathing. So if you're running past someone, unless someone directly coughs in your face, you're not going to pick it up. Even if you happen to be running behind somebody who's coughing, I probably would get out of their way then, because you're then going to run into their slipstream if they're coughing and they've got symptoms. However, if someone's breathing normally and you just happen to be passing transiently, you're not going to pick anything up. So that's why I say when people go and exercise, don't go out and sit on a bench or sunbathe. Keep moving. That's what
Right.
we want you to do. You know, you can go outside. It's great for your brain. It's great for your body. Try to do some activity if you can, but just keep
Keep
moving. That's
moving.
what you should be doing.
Well, I have to tell you about keep moving today. I mean, you do have to find humour in some of it. I was in the States here with the fish counter. You have to. They've got lines now, so you're reaching across to get
Yeah,
anything anyway.
yeah.
So I'm standing waiting, 3 feet away for my fish to be cut up and what have you. And a woman wanted to pass in front of me. She had the mask on, she had the gloves on, she had the pushing the trolley, or the cart as we call it here in the States. And so in order to maintain social distancing, which she wouldn't have been, she crouched down and ran behind the trolley past me. I was like, people are...
Oh, it's just, you're walking past, the risks of something like that are extremely low. I mean, I've seen a lot of people out and about with all sorts of paraphernalia on, and then they pull the mask down to have a drink.
Oh, I know that was on my flight. I had a guy in a hazmat suit. The guy was in a hazmat suit until the free drinks cart came round. Then suddenly, I suppose it was alcohol, boom, boom. But,
Yeah.
and all sorts of, Darth Vader,
Yeah.
Skywalker wouldn't have known who Daddy was. and they all came off when the drink trolley came round.
I know,
or put
exactly.
them on their heads.
Yeah.
Put the mask
I mean,
on their heads.
this is the thing. And the thing is, what they do is they touch things and they touch their mask. You get virus on your mask, and then you put it back on your face, and then you breathe it all in. This is the worry. This is why I think in the UK we haven't recommended that the general public wear masks unless they're especially at risk, and they've been advised to by their medical team, or they've got symptoms and it's to prevent it spreading to other people. Masks might be a good thing. However, if you use them wrongly, in the wrong way, they could be a very bad thing.
When you say wrongly, that's when we were talking before about the
wrong kind of mask, not changing it enough, touching it a lot, and forgetting to, being complacent with all your other measures because you feel you're safe wearing a mask, so you might take more risks.
Or the other one of the things I've seen are people with masks and gloves on their phone. And the minute, I don't know where their phone's been, but obviously they've at some stage touched their phone, maybe not cleaned it. And then, of course, the phone is up against your face.
This is exactly it. People are touching things. They're getting their phone out, touching their phone, putting it to their face. You might as well be rubbing your face wherever you've touched, because that's essentially what you're doing. And that's why I think masks and gloves may make people complacent, and you're better off, and it'll be cheaper to stick to the standard stuff.
Right, let's talk about pre-existing. People keep saying about pre-existing. I'll be selfish and ask my question because breast cancer, 12 years on, still cancer-free. Now, as I understand, it's people actually going through treatment. When you're going through chemotherapy, your immunity tends to drop. There's someone I know whose son is on dialysis, for instance. And then again, with my elderly dad has breathing problems. Those to me are obvious things. But can you just briefly tell us, when we talk about coexisting, what are we talking about?
So what we found as the coronavirus situation evolved and people were sadly dying from it, people were looking at the common factors, whether there were other conditions that were more common amongst these people that were passing away. And what they found is that there were certain heart conditions. So if you've got a pre-existing heart condition, or you've got high blood pressure, if you've got a pre-existing lung condition or a respiratory problem, then those conditions tend to be more common in people that pass away. It's not that the condition causes a worse disease in coronavirus. It just happens to be an association, which is why we say you might be at higher risk if you get coronavirus, and that's why you need to be extra careful. Other conditions we think may be high risk are if you're immunosuppressed. So if you've got a significantly weakened immune system, which could be because you're on chemotherapy, could be because you've got a certain underlying immune deficient disease. It could be that you've got HIV and developed AIDS and your immune system has been affected. If you've got HIV and your virus is under control and your immune system is fine, then you're not at increased risk.
What about pregnant women?
So the other one I just quickly mentioned is diabetes. That's the other one to be careful of. And there's lots. If you go to your government's website, they will have a list of predisposing conditions that you just need to be extra careful. Pregnant women is an interesting one because we are being extra cautious with pregnant women because we're still learning about this virus. What we have found actually, from the evidence we have so far from around the world, pregnant women don't appear to be at increased risk of getting coronavirus, and they don't appear to be at increased risk of developing severe disease. They don't appear to be passing it on to their babies. And actually, even when women have it around the time of delivery, their babies tend to be okay. Now, as I say, we're still learning, because obviously there are only so many pregnant women around the world and so many of them will get coronavirus. But the news is positive so far. But what we do know is pregnancy makes your immune system do weird things. And therefore that may put you at it does sometimes put you at increased risk of getting viral infections. For example, the flu, when you're pregnant, can be really nasty.
Right.
So that's why we are taking the same precautions with coronavirus. Even though we don't know it's going to be exactly the same, we're going to be safe, just because obviously there's a lot at stake. So we're learning, but it would be better to exercise caution.
Better safe than sorry. And
yes.
Now some people are saying, look, I see on your Instagram, did you cut your own hair today?
I did, look. I got a quarantine part.
Pretty good.
I mean, I did use a YouTube tutorial, and you know, it's kind of a little bit patchy. Don't look at the back. The back is awful, Trisha. The back, oh my gosh, the back looks like I've been attacked. But I'm really impressed. But a girlfriend of mine does hair, and she says she has been offered stupid money to come to clients' houses to do their hair. As soon as quarantine is lifted, as soon as lockdown is gone, there are going to be a few businesses are going to do really, really well. Beauty salons, hairdressers, pubs and bars and clubs.
Yeah, but you shouldn't be going. What about false nails? There you are. What about false nails? Because a lot of women, I mean, I tell you one thing that you can't find. Nobody's ever brought this up, but one thing that it seems to have disappeared from Boots, and over here it's in Australia it's Soul Patterns, and over here it's at CVS, are the false nail kits.
Right.
They're gone, because women are obviously having to do their
You're doing your own. You're doing your own. You cannot be going to nail salons at the moment because you are touching hands. That's the point.
But what about, people are saying, do they make it, are they making it, are you making a hotbed for the virus?
Well, if you think about it, potentially, because you've got a bit of foreign material stuck to your hands that may not be that easy to clean when you wash your hands, you may not be able to get around and under each nail, then potentially there could be virus stuck to it if you happen to touch something with virus on it or you were symptomatic. So if you want to be 100% sure, don't wear false nails. Just, I mean, you might have to figure some other kind of arrangement with your
nail brushes? Would they help? Would nail brushes help?
Difficult to say. My nail care knowledge isn't that great.
Well, unless you've got great long, huge talons.
I mean, unless you're very meticulous with your hygiene around your nails, I would keep them shorter, and I would make sure that they're clean. But there are other things you can do with your nails. You can still, make them nice. You can still paint them. You can still kind of polish them and buff them. Yeah. You don't necessarily have to have false nails to do that. For now, for the next, month or two, maybe you could do your own kits if you want. That's okay, as long as you're using brand new kits and things like that. But just bear in mind that you're just going to have to pay extra attention to washing your hands.
So the general rule is you don't have someone, oh, good, I found someone who'll come to my house and do my manicure, my hair.
No, that's too risky.
It's just way too risky. So
the DIY job, Trisha, DIY.
Let's talk about alcohol.
Oh, yes.
Well, do you think... I think anecdotally, you're going to have a lot of, I know somebody who's in recovery, and this is a really, for people in recovery, this is a really, really tough time. They can't get to their groups. And even if they can, I know a lot of NA and AA are doing Zoom or what have you. But the actual part of the habit breaking, if you like, for many people is to form the habit where they go to group. And that's the same with counselling and what have you. The actual thing of getting on the bus, travelling, going to see the same people and what have you.
The ritual of it, isn't it? Yeah.
And I know a lot of people are struggling with substances and with alcohol. For people who, let's say you and I or anyone else, my alcohol consumption's gone up.
Yes, me too.
The bottle shops are nearly
Yep.
I mean, booze and bog rolls.
Booze and bog roll. This is it. Booze, pasta, and bog roll all went flying off the shelves.
But on a serious note,
Yeah.
how do you juggle anxiety, staying in all the time, and alcohol? Because I'm sure, what is it, the 7 units a week or whatever, people are like,
Yeah, well, in the UK, it's 14 units a week. It varies from country to country. So I don't knock people for using food or alcohol as a bit of a crutch in times like this, but you have to be very careful that it doesn't get out of control. I had to have a word with myself this week because obviously we're spending a lot of time at home. You've got a lot of time in your hands. There's temptation just at the end of the night, have a glass of wine, maybe a couple more. You're on a Zoom call or something like that with some friends. A lot of people are drinking on those. It's very easy to slip into that habit. Also, if you've got a pre-existing, I suppose, addiction or a dependence on it, this situation is just going to make it worse.
Yeah.
What you've got to do is try and keep a level head about it. Occupy your time with as many other things as you can. Make sure you've got a routine so your mind doesn't naturally go towards that. If you're feeling anxious or if you're feeling worried and you feel like you need something to, I suppose, quench that thirst or that urge, talk to someone. You know, there's lots of other ways that we can, like you said, you can still connect with people, even if we can't see them face to face. And if you are really struggling, there's lots of charities usually that run helplines and outreach services. They may be able to help you remotely. And remember, your healthcare services are still there. Sure, they're dealing with a lot of coronavirus at the moment, but if you're really in trouble, be it physical or mental health, then the emergency services are still there for you, especially in the UK.
What people are forgetting, aren't they? I know a lot of the doctors on, on social media are stressing over and over again. They're starting to see people turn up too late.
Yes, that's a serious concern.
Staff problems or children whose temperature spikes. Because is it because people are scared if they come to hospital they get the virus, or we're all standing there clapping for the NHS or our healthcare professionals, and we don't want to burden them with what we've got?
Well, it's all of the above. So I've heard from a lot of people that are worried about going to their doctor or their hospital because they think they're going to catch coronavirus there. Right. Just remember, healthcare facilities have the most meticulous hygiene right now, and you're possibly, and they will be, paying extra attention to keeping people separate. So you're not necessarily going to be at increased risk just by going there, but you may be at increased risk from staying at home with a worrying medical condition that could get worse. Some people are putting their symptoms down to coronavirus, and it may be something completely different. I tell a lot of parents, for example, that not all fevers or temperatures are coronavirus. Remember that. At the moment, we're very, very, if you've got a temperature, it might be coronavirus, stay at home, isolate, etc. But just remember, it's not all coronavirus. And I suppose there is a little bit, especially from the slightly older population, of people who don't want to burden the NHS. They don't want to be a burden, and they've seen all this stuff in the news about how everyone's struggling. We're seeing lots and lots of patients. That's true. However, we have stepped up. We have upped our facilities and upped our services to cope with extra demand, and we are waiting for people who are poorly to come in and get their appropriate treatment. Please don't feel like it.
Somebody just said that they're terrified of going to hospital with their 2-year-old because they think they might catch the coronavirus. Well, just to reiterate what Dr. Ranj was saying, it's the safest place you can possibly go.
Possibly one of the safest.
Playground.
Exactly. And also remember, your child may have a serious condition and you don't really want to be sitting at home and taking that chance. And that brief encounter that you have in hospital where a medical professional may reassure you, you can get back home quickly, and then at least you've got peace of mind that it isn't anything serious.
So let's go through the symptoms for the millionth time. Somebody said it's sneezing, because I get hay fever at this time of the year.
Yes.
And I sneezed so quietly. I held my breath and sneezed when I was out because people look at you so strangely. I mean, I wet myself.
I don't think that's a symptom, Tricia.
Because everybody looks at you if you just go. It's like,
I know. You know what? It's it's more acceptable to fart in public right now than it is to cough or sneeze.
I know.
It really is ridiculous.
I know.
You cough right now, everyone's like, what?
I know. Quickest, easiest way to get your line in the queue.
Oh, absolutely, to clear a crowd.
But jokes aside, the symptoms are is sneezing, because this is hay fever time.
Yeah, very good point. Very, very good point. So sneezing is common to hay fever. It's common to the standard colds. It's not a common feature in COVID. Surprisingly, other symptoms that are much, much more common are fever, temperature, aches and pains, particularly back pain, leg pain. Headaches seem to be quite predominant. Some people get a bit of a sore throat. Cough, obviously, is a really important symptom.
When you say cough, though, are we talking about now and again, or constant cough?
Well, it doesn't have to be constant as such. It's a new and persistent cough. So it's a new cough that you've developed that basically isn't just like a cough here and there. It's not, so it's a cough that you've definitely, I've got something. It feels like I've got something. Also, some other people are reporting things like tummy upsets, so diarrhea. And interestingly, this is a really interesting one that's emerging at the moment, loss of sense of taste and smell. Particularly amongst younger people, tends to be a more atypical symptom. And recently, a study just showed that people who tend to get over their illness relatively quickly. So we're learning about whether loss of taste and smell might be a symptom as well. I would just say, if you're worried, consult a healthcare professional over the phone or online, look up the symptoms. And then obviously, if you think you might have it, isolate yourself and be careful around other people.
The figures seem to be showing in the UK, I know, and the US, that there seems to be a high prevalence against BAME, or we call Black
and minority ethnic.
Ethnics. Now, is that because of socioeconomics? Is it because of, I don't know, overcrowding? Or is it because of susceptibility?
So that's a really interesting topic, actually, and it's one that's been discussed quite a bit recently. So what we have to, there's lots of factors at play here. We know that BAME people, ethnic minority and Black people, have a higher, I suppose, incidence of things like heart disease, diabetes, chronic illness, that sort of thing. And those conditions we know automatically put you in a higher risk group of getting more severe COVID. On top of that, we have social practices. So we tend to be in big families. We tend to be quite tactile. We tend to hang around each other. Some people may not understand some of the advice around it because of language barriers. So I think we've got to bear that in mind. And then the other socioeconomic argument is access to healthcare. Now,
in the States, that's a big one.
Especially in certain parts of the world, you may not have access to testing, you may not have access to treatment, and that's why you may be disadvantaged from that point of view. So all of these things kind of add up at putting you at greater risk. Interestingly, the most recent data from the UK shows that it's much more common, we think, in South Asian communities rather than the Black community. And we don't know why that is. That could be language, that could be understanding, it could be social practices. We live in extended families often. So there's an increased risk of passing it around. But like you said, it depends on your access to healthcare. That's such a big part. And we know that in America, Afro-Caribbean people are disproportionately affected by COVID, because of a lot of these factors.
Yes, because of a lot of them. My daughter was telling me, apparently, I don't know if she's pulling my leg, about sex guides. And apparently...
Oh, I got a good one for this one.
Oh, go on.
So as we know, Tricia, in this current day and age, which wasn't around when we were younger, hookup apps and, Tinders and Grinders and things like that, they're a lot more commonplace, and it's much more common way that people meet each other, and sometimes people use them to fulfill a certain need, which is absolutely fine. There's nothing wrong with that. However, in times of a pandemic, hooking up probably isn't a great idea. I mean, you can hook up with your partner who lives with you. That's absolutely fine. What you shouldn't be doing is hooking up with people outside your household. So that's where the saying, hand jobs, not hookups, comes from.
Oh, they actually
because
saying that.
you need a little bit of self-love, maybe now. That's an important time.
I got to stop.
Oh, what were you talking about?
No, thought you meant.
Not for
Oh my
other
gosh.
people.
I thought you meant not other people doing hand. Okay, right. This is all news.
No, hand jobs, not hookups. That's what we're
Right.
saying. Is basically, it's all about, there's been a huge surge in people accessing porn, actually, because of this.
Really?
Yes, there has been, because people need to get their fix. That's absolutely fine. We're at home a lot more, and we're having to help ourselves out,
Right.
which is probably the safest form of sex at the moment. So lots of people are rediscovering masturbation. There seems to be a reawakening, a sexual reawakening around masturbation, which I don't. And sex toy sales are going through the roof,
So
which isn't a bad thing.
some
Which
businesses
isn't.
are absolutely taking off.
Some businesses are definitely,
Are they going to
definitely
be lots of
skyrocketing.
babies, though? Are they going to be lots of babies?
Well,
On a serious note.
Yeah, well, we saw this within countries like China. We think that there's going to be a baby boom. In 9 months from now, there'll be a lot of babies called COVID and Corona, I think. The flip side of it is, though, interestingly, they have seen a rise in divorces as well. And you touched on the subject of domestic abuse. And I would actually put that in the same sort of area as child abuse as well.
Yes.
We are seeing significantly, terrifying increases in incidences of domestic abuse and people contacting helplines because being at home is a risky place for some people, and that terrifies me and makes me it breaks my heart that something like that is happening, and we all need to be on the lookout for that. Look out for people around you, because it's a silent cry for a lot of people.
It is a silent cry. And there are some people who have accessed help. I'm slightly biased because I'm patron of Home Start, which is a parenting charity. And they are doing Hello to Home Start in Norfolk, because rural areas especially, and they're doing a lot of things, like we are. But it's still not the same as alleviating pressure with a mum, maybe on her own, who may have mental health problems, or mum with multiple babies or whatever. Anyone who's under pressure, doing this is going to often add extra pressure rather than somebody actually coming in and alleviating and helping. Although we know a lot of those children can actually access schools. I know in the UK, only a small minority actually are, though.
Yeah,
this is found that at-risk children, or children who are known to social services, the full number of them who are allowed to go to school aren't going.
Well, this is the worry, isn't it? School represents an escape for some children, and it represents an opportunity for another professional just to be keeping an eye on them. We also have things like health visitors and social workers, obviously, that go into the home, particularly with at-risk families. Same with women who may be, and men who may be at risk of domestic abuse. Work, sometimes for them, is a bit of an escape and an opportunity, or an outlet potentially to get help. They're currently all indoors, and I think there are going to be, and you touched on the topic of people with mental health difficulties that are going to be stuck at home and finding this really difficult at the moment. What we have to do is offer as much help as we possibly can.
Whoops. Sometimes these things happen. The line, somebody was actually saying as well that they have a family member with autism.
Oh, do you know what? Instagram only allows you 40 minutes, I think, on a live, which is why it cut out.
Oh, so
that's what. Yeah, the point I was making is putting in all of those extra services to try and get to those vulnerable people. But I guess the only other way around this is that we shorten this lockdown as much as possible. And that is only going to happen if we obey all the rules right now. If we flatten that curve, as everyone keeps talking about, cut down those number of cases, get out of lockdown as soon as possible so that these people can access proper help.
All right. Well, thank you, Ranj. Thank you so much. And I know we've got
My
so
pleasure.
many other questions, and and obviously there's a real thirst for knowledge, and you kind of think, isn't it covered so much? But I really think that there's snippets here and there, and there's so much rubbish. I mean,
you just got to be careful of the fake news.
Oh, well, poor old Australia's dealing with this whole world of homeopathic remedies.
Oh, gosh.
Yeah, scary stuff.
Stick to the evidence-based stuff. Stick to the reliable, accurate sources of information. Don't believe the hype. Don't believe the fake news. Just be really, really careful.
All right, Ranj, thank you again so much.
My pleasure.
I'll try and edit this down and post it, so because people are desperate for more information. It's been really kind for you. It's 11 o'clock. What is it's probably midnight
It's
over there now.
quarter to midnight. It's my
Quarter to
bedtime.
midnight. Oh, you'll turn into a pumpkin or
I'll
something
turn into a
like that.
pumpkin in 15 minutes. But thank you so much. And I just have to say, I I hate to say grew up because I'm not much younger than you, but I grew up watching you, and
Oh,
this is a real treat for me.
oh
It's
bless you.
I'm sitting here fanboying, Trisha, because I watched your show on ITV, I watched it on Channel 5, and then you went to the States, and before that you'd been in Australia. I mean, this is an absolute joy. So thank you for having me.
Oh, bless you. We might even do this again if
Yes,
further down the line.
absolutely. Yeah, let
Because
me know.
so many questions are coming in, and people joined a bit later. So let us
Yeah.
be watching, or tell people, keep the word out, and keep looking at either Ranj's Instagram or mine.
Thank you.
There's a
Yes,
lot of
absolutely.
information on your Instagram, and we might do this again further down the line, because I'm sure you'll get a
Definitely.
whole new load of. Thanks again.
Yes, absolutely. Take care.
You too.
Look after
Bye.
yourself. Bye
You too.
bye.
Bye. So thank you for joining me. And as I said there, we'll definitely do this again. So you can follow Dr. Ranj on Instagram, and as we told you, the really good places to get information. Your country, in the States, the CDC, National Health Service. There are other ones in Australia. Well, I'm sure the Aussies will tell me who the official place to get information from, because there is a lot of rubbish going out there. And also, what I've been seeing here in the States as well, there's a kind of a pack mentality. If you haven't got a mask and you haven't got gloves, you're killing everyone. And it makes you anxious. Whereas really what you might be putting on a mask, as you heard from Ranj, you might be putting on gloves. 90% of the masks I've seen are not doing any good. And wearing gloves can actually make you more complacent. You're more, as you heard from Ranj there, you're better off making sure your phone is clean and you wash your hands for that 20 seconds. And I've got to go and take my false nails off. Do not have people coming around to your house to do your hair, to do your nails, to your favorite manicurist. They're so sweet, they're turning around, coming into your house, or popping over to friends' houses and having a get together because you know them. All of those things, as we heard, are unfortunately helping to spread the virus, and those amongst us who are more vulnerable, we need to think about them. And also, please keep an eye out for your neighbors, because not everybody has a happy home, and some people may need some respite, and that is where COVID is the least scary of the options. It's sad, but that's life. In the meantime, thank you for watching, and take care and be well physically and most importantly mentally. Bye bye.